Morning, everyone. Welcome again to another chapter of Pathway to Wellness Navigating Our Journey. I'm Marie, your host. Today, for our Project MAP learning challenge for today, we will do Navigating Health Systems, Turning Barriers into Pathways. Our learning objective today is understanding what a health system is, recognize common barriers many people encounter, learn practical ways to navigate care more effectively, and feel empowered to take one meaningful step for themselves or someone they love. Imagine you're 28 years old. Your mother hasn't been feeling well for several months. She's been coughing more often, she's exhausted, and lately she's been missing work because she simply doesn't have the energy she once had. She doesn't have health insurance. You're worried. You want to help, but where do you begin? Should you take her to an urgent care clinic, the emergency department, a community health center? Will she receive treatment? What if the bill is more than your family can afford? Unfortunately, this isn't just one family's story, it's a reality faced by millions of people every day, everywhere. So today, we're going to walk alongside that daughter. Her name is Soraya, and through her story, we'll discover how understanding the health system can help families find pathways instead of barriers. So, welcome to Pathway to Wellness, navigating our journey. Again, I am Marie. I am the Global Health Specialist and Executive Director of Project Heal of Santa Barbara County. I also bring a retired nurse's perspective, so I really have a wealth of information. Here on Pathway to Wellness, navigating our journey, we take today's health challenges and look at them through a practical, compassionate, and evidence based lens we like to call Project MAP lens. So you can better understand your options, support your loved ones, and make informed decisions. So, today's resources we'll use will come from World Health Organization, Health Systems Frameworks, Global Health System Frameworks, and nursing, I guess we'll call it nursing diagnoses framework. We'll also draw upon principles of health literacy and patient navigation that are used around the world to help people access care more effectively. In today's case study with Soraya, we'll look at is navigating healthcare sometimes harder than the illness itself? For many families, the answer is usually yeah. So using our Project Map lens, there's five approaches that we use: the observe, the understand, the connect, the evaluate, and the empower. So let's look at the observe. Let's go back to Soraya, who lives in the Caribbean, in the Dominican Republic, to be exact. Let's begin by observing her situation. What barriers do you notice? Not the illness, the barriers. Let me give you some examples of the barriers. We're looking at no insurance, fear of cost, transportation, not knowing where to begin, time away from work, caregiver stress, right? These barriers aren't unique. They're experienced in different ways by people and families across many communities. Step two, let's look at how we understand this information. What is health system? Well, it's not just hospitals when we say a health system. We're talking about primary care, public health, community clinics, mental health, community health workers, patient navigators, pharmacies, insurance, emergency care, laboratories, nonprofits, transportation, and health education. That's 13 different systems. You might say, let's let's look at these systems and what do they mean? What does that matter? Well, because we got to look at these health systems as networks, not just buildings. They're networks. Step 3, let's connect this information now that we know what health systems actually look like. Well, who experiences these barriers? Well, some examples of that could be older adults, children, people living with chronic illnesses, people with disabilities, rural communities, immigrant families, individuals experiencing homelessness, caregivers, people with limited financial resources, and anyone navigating a complex system. Now we look at every person's story differently. What these situations have in common is that additional barriers can make accessing healthcare more difficult. Recognizing these barriers is the first step towards addressing them. This keeps the discussion accurate and avoids overgeneralization of any group. Okay, so now we're at step 4. Well, how do we evaluate all this information as it relates to Soraya? Well, returning back to her story, instead of panicking, what options could she explore? Well, here we go again with our checklist. There's community health center, county clinics, hospital financial assistance offices, patient navigators like us, community health workers, prescription assistance programs, interpreter services, nonprofit organizations, again, like us, public health departments. We list those all on our website. And we really have to use these resources everywhere that are available, right? Many communities have organizations dedicated to helping people navigate care, and it really doesn't matter globally where you are. There are always organizations out there that can help with resources. So, our last component of our Project Map lens is empower. So, how can we empower Soraya? Now she's no longer alone. She has options. She knows who to call. She understands the difference between urgent care and emergency care. She begins asking questions and she becomes an advocate for her mom. Then, knowledge doesn't just eliminate every barrier, but it often helps people find the next door to open. And that's really the empowerment, right? The next door to open. Now, let's do a little compass check. From my practice, throughout my years as a nurse consultant, patient advocate, nonprofit executive, and now as a global specialist, I've learned something that continues to shape how I think about healthcare. Many of the greatest challenges families face aren't caused by a lack of caring healthcare professionals. It's not that. They're usually caused by confusion, paperwork, transportation, financial concerns, language differences, and not knowing where to begin. That's why health education matters here. Because when people understand how to navigate the system, they're better prepared to care for themselves, their families, and their communities, which is the cornerstone and mission of our work. So, what is the PMAP takeaway? A strong health system isn't measured only by the care it provides, it's also measured by how well people can find, understand, and use that care. Every week, we will continue to close our chapters with a Project MAP action challenge. Your action challenge is for this week: take one step to strengthen your family's health navigation plan. And I will leave these actions in a description box below. Choose one or more of these actions. Find the nearest community health center, urgent care clinic, and emergency department in your area. Save that phone number for your local public health department. Create or update a medication list for yourself or your loved one. Organize important medical documents and put them in one easy to find place. Learn about one nonprofit or community organization that helps people access healthcare like us. If someone in your family would benefit from language assistance, identify where the interpreter's services are available, and have a conversation with a parent, grandparent, neighbor, or friend about what they would do if they needed medical care unexpectedly. I know that is a lot. You don't have to do everything today, y'all. Every one small action make a future health challenge easier to navigate, right? So in closing, thank you for joining me for another chapter of of Pathway to Wellness Navigating Your Journey. For this chapter, PMAP 003, we will leave you a field guide download that you can go to our website and download for yourself as a little cheat sheet. And until next time, don't forget to like, subscribe, and share, and continue asking questions, continue learning, and continue thinking about how you can navigate your own journey and ways that you can simulate organizing information and disseminating it to where you can understand it better. Coming here to this YouTube channel helps in doing just that. So take care in caring for you and your tribe. See clearly and navigate wisely.